how it started for you, this process. How many centimeters you did? When did you have removal surgery?
What kind of medicines you used during the lengthening time?
When it started the infection first. And thank you, you always listen our team.
Hello everyone, I'm medical team manager of Livelifetaller. Today I'm with my patient.
Hello everyone, I'm head physiotherapist Tuğba. Today, yes, also said we are with our patients from
India.
Yes, today is last day for you in this building, this center. We are really sad because of that, and I want to learn how you feel.
I mean, like, it is never, I could never feel that this is the last day because it feels like I'm just, I just came yesterday. So it has been very emotional. I got, really attached. I'm not exaggerating, but really attached to the physio team, the medical team, the admin. So it has always been a good journey, and it's like a family. But for sure, I'll be missing. But we have to go on.
Yeah.
And I hope we can meet very soon.
Yeah, I hope so. And it's really long process and long time together, it's every day we see each other, and it's also hard time sometimes.
Yes, it will be a hard feeling because I've been seeing every day, but this 3 months is just like a matter of time, but it was very quick, and it was a long journey, but it looks very short.
Yeah.
As I said, I really feel emotional, and there were like very memorable journey. You started with pain and you're ending with the happiness. So that's one big thing, you always tend to remember in your life. It's a life-changing experience. So you need to feel it. It's difficult to express in words rather.
Yeah, you're right. So you can't explain so with right sentences and right words. It's really, I can understand you, but also we try to explain. You told me it's the start with the pain. Yes, how it started for you, this process?
I mean, the process, I was very, once I came here, when I saw the patient, you always have that fear, the hesitant to whether to go for the surgery. It was a hard decision, but it was ended in it was a right decision indeed. But the first instance was to just explain the journey in very short. The first 3 days in hospital was, you always have the painkillers, you didn't feel much pain. Mm-hmm. But coming to the rehabilitation center, the initial 2 weeks was a bit, it was not that easy. But I would really appreciate the medical team and the physiotherapy team, because as everyone, all the patients feels that physiotherapy is very vital, and for me, I'm able to walk after 2 weeks of the removal. Mm-hmm. Trust me, it is just because of the physiotherapy is like 70%, and also the good care of the medical team. And I really appreciate Amar, Sonia, Senubir, Ozlem. They have been incredible. I have had 2 infections on my leg, and it was not an easy feeling. Changed my bandages, and they took care as a family. And being alone, you miss your family, but that's where the LLT plays an important role. He has been incredible. He's like my I will really miss him, and the physio team, everyone, and Christina especially. She has been my physiotherapist. Yeah. She has always motivated me.
Thanks to Christina, by the way.
Yes, she's not here, but thank you, Christina, and everyone like Ilaida, Asiya, Akim, brother, and mostly you're very attached to me. So I'll be missing everyone. I know each and everyone personally, not personal in the sense, they're so attached as a family. Yeah. So this journey, when I realize that it's going to end, I feel very sad. But we have to move on, and sure we will meet again.
By the way, it's an important question. How many centimeters you did?
I reached 8.2.
8.2 centimeter on femur with the Ilhan method,
Yes,
right? What's your height now?
I'm almost 168.
68. It's
Yeah.
really big
Yeah, it's a
change,
good,
right?
it's a big difference.
Big difference.
Yeah.
Because you dance, you walk just without anything. With Precice doesn't matter. You walk, you work. By the way, you have to work, and you did your exercise.
Yes.
It's really also thanks to you.
Thank you. And also, I would like to, tell this to other patients who will be, doing the limb lengthening or who are doing the limb lengthening. That listen to the physiotherapist, listen to the medical team, because I never, said no. So they are better. They have handled a lot of patients. So they are the best people who can advise you what is right and what is wrong. So
Thank you.
always listen to them. Be a disciplined patient. Always stick to the instruction which is given by the team. So.
And you told it's really important for also you and I, the infection. I
Yes.
will talk about not infection after, but how it affects also for physiotherapy. But first, how is the infection process for him?
The first, during the lengthening time, he got infection 2 times from the downside pins. First, we see some liquid and it's getting sometimes better, sometimes not. We said, don't worry, we will clean it, we will fix it. And we talk with the Dr. Halil every time, and also with the physical therapy team. He stopped doing lengthening sometimes like 3,
Almost 5 days, yeah.
5 days. And then he used some antibiotic pills, like normal one, not the hard one.
Sir, is it the superficial infection?
Yeah, this is the superficial. Yeah, on the skin, only the skin side he got infection, and he did LOM method. In the skin, he doing lengthening not only for the bone, for the tendons, muscles, and the skin also. That's why he feels some pain during the lengthening time, especially infection time. But we fix it. We talk with the Dr. Halil also. Yes, he got infection 2 times, but he fixed it. He's okay now. Before the removal operation, before 1 week, your scar is getting better first, and then we talk with the Dr. Halil, and he checked your wounds before the operation and also operation time on the surgery room. He cleaned your wounds, and they told me something about your scar. And then now all in your scars is closed. Yes. You live in from the rehabilitation center today, but I think after 2 or 3 days you will take a shower also.
Finally, I've been waiting for almost 2 months afterwards.
And one more question: when it started the infection first? And how long he felt that?
The infection is started second.
When I reached 4 centimeters.
4. It's almost 3 or 4 weeks after.
After the first operation, 3 or 4 weeks, and then first we see some swollen on the legs, and then we check the scar. We talk with the doctor, and then he did some exercise also. And then the scar is getting bigger a bit.
I remember, please correct me, I couldn't be sure. 2 weeks we saw the sensitivity around scar, right? And after, two weeks around, right?
Yes.
Yeah, and after the other legs.
Yes,
Okay,
it started with right and then left.
Now I want to talk about from physiotherapy side. Yeah, he got swelling around the pins, and also some days went to outside a little bit,
Yes.
like and your bending was so good, but after the swelling, it's a little bit makes the
Yes.
resistance, right? It's of course uncomfortable, but also swelling mechanism, also it's like protect mechanism of body, and that's why it's also a little bit hard for our side, but it's after getting better. Also, we did so many things for the swelling, for the around the scar, like laser therapy, like cold massage, compression.
And also the ultrasound was very helpful.
Yeah, also ultrasound system. It's also so helpful. That's why we always talking about that. Why device therapy is really important. Why it's not just enough the manual therapy. We also have to control on that process. It's not just infection, it's also affect your mobility. It's affect your walking. It's not just about pain.
Yeah, I mean the left was affected because of the inflammation, the infection. But before that, the mobility was good. But later, in just 2 weeks, because of physiotherapy, I'm able to bend to the normal.
Yeah.
So that's what, like, it's a teamwork, like physiotherapy and medical, they play, vital role in this process. And I've experienced it, so that's the reason I'm really stressing that, physiotherapy and medical both are, very essential.
Yeah, we always talking about, every day, okay, today swelling is much better, but please do something, Ömer, okay? We have to work together, it's really, and also nutritionists.
Of course, yes.
Yeah.
I was about to come to nutrition because it was very difficult. Coming from another country. It's very difficult to know what is the local food, what you can eat, what is the calories, what is the protein content in each food. But the guidance from Meltem was really good, and she helped me a lot to give some supplements as well as recommendation of the food which has the protein content, the calories. So a special thanks to Meltem as well.
So we need support from the nutrition because it's your bone healing, your muscle, it's really teamwork. And thank you. You always listen our team.
Thank you.
Whole team.
I wanted to thank the admin team, the security people. They're always, they are, the backbone of LLT, I would say, because, they're running behind all the patients whenever required. Even small things make a big difference because, when someone needs, to go to the ATM, it might be an admin job, but that plays an important role. Likewise, I just thanked all my medical team, physiotherapy and everything, but they are always like, always on the back side they've been. So
also that part is so important.
So that's coordination, and the admin work is also very important, and I really appreciate them for being so supportive.
What kind of medicines you used during the lengthening time?
No, there's a different medicines for antibiotics, which for inflammation I've taken for normal painkillers. So not much, but even for the nerve pain which I had during the lengthening. So couple of different medicines which I have used.
And also you're going home today with only some couple of boxes medicine.
Yes.
That's for the safety. Yes. When you have pain on the plane, when you have pain on the home, like that's it. Only for the 2 weeks or something.
Yes.
When did you have removal surgery? How many weeks?
Exactly 3 weeks.
3 weeks.
Yep.
Okay. How about your walking now? How you feel?
Yeah, I'm good. I think I'm doing better. When I started, I was not able to. I was able to walk, but I always there's
a small swing.
Yeah,
but
swing.
So less now.
Less, but I can walk normally now. That is a great thing, to recover in 3 weeks, and with the support of everyone. It's not my work alone or my body condition, but it's your surroundings and the people who support you or makes you do better.
It's not so easy walking just after 3 weeks removal surgery, But also again, thanks to Christina, you be working lengthening and recovery at the same time. And after removal, you can just focus on your recovery and you can walk easily after just a couple weeks.
Exactly.
That's the important thing, and we are so happy. I'm so happy your result. Really, now you need, of course, some special exercise still, but after that, just you can live life taller, your life,
normal
and
life.
I hope everything will be perfect for you.
Thank you so much.
Now we really welcome to our family. That's why we always say that 3 months patient.
Family forever.
done.
see you soon. I hope, right? It's not the end.
Thank you so much, Liban. Come on, come on, come on, come on, come on, come on.